Welcome to our presentation about the North West Sector Partnership. This is a partnership that is of the 6 NHS organisations across Wigan, Bolton and Salford, including both the commissioners and the hospitals. The reason for us coming together to work in partnership is to transform healthcare that we provide to our patients and public to ensure that we will be delivering both the highest quality of standards of care, but also ensure that is reliably delivered across the 24-hour period.
I've been working with my colleagues in emergency medicine and acute medicine for nearly 2 years. We've all realized that we have gaps in staffing in terms of doctors and nurses. We've realized that there are limited resources in terms of finance, and we have all seen the tremendous pressures both acute medicine and emergency medicine have been facing day in and day out. We soon realized that by working together across the 3 hospitals, we can provide consistent, high-quality care, which is fit for the future, delivered locally, and in line with other organisations in Greater Manchester.
Through Healthy Together, our commissioners have quite rightfully challenged the 3 hospitals to develop a model of care that delivers standards that we would expect for ourselves and our loved ones. That model of care needs to make best use of taxpayer resource and utilise the existing clinical workforce. That will involve the care of high-risk abdominal emergencies being centralised at Salford, with a large number of other lower-risk cases remaining at Wigan and Bolton.
Vast majority of the patients are looked after in the community by the general practitioners, by the nursing team, by the pharmacy team. Only a small number of patients need to come to the hospital for specialist care. It is only through closer working with the primary care, social care and community services we can improve the services within the hospital.
One area in which we can save lives is general surgery. We know that timely access to a senior opinion, investigation and surgery for life-threatening abdominal emergencies improves the chance of survival. We believe that general surgeons from the 3 hospitals working together will provide the best long-term sustainable service. In contrast to general surgery, our accident and emergency and acute medicine teams will remain based at their local hospitals. We have been working at developing a model of care that delivers reliable services to the local population and develops a workforce that relieves the pressure on the overstretched medical workforce. Timely access to imaging is a key component of safe medical and surgical care. Our limited specialist radiological workforce makes this impossible for any one hospital to deliver this 7 days a week. By utilising the limited specialist workforce across the 3 trusts and utilising modern technology, we will ensure that access to imaging is delivered as close to home as possible 24/7.
In addition to the services we've already been discussing, we've also identified a number of services that may benefit in the future from our wider transformational work. These include services such as urology, breast care services, dermatology and possibly orthopaedics. In some of these services, it is about us bringing together colleagues in a single service, and in others it will be about making appropriate use of the number of specialists that we already have. The North West Sector Partnership focuses on the care we are providing across Salford, Wigan and Bolton. However, the partnership also allows us to work closely with our colleagues across Greater Manchester to ensure that we will provide the best quality of care no matter what time of day you present and no matter where you live. Thank you for listening. If you have any comments or questions, then please do ask.